You reach for a high shelf, and suddenly there is a sharp, restricting catch in the shoulder. The joint simply refuses to move. Medically, this condition is adhesive capsulitis, commonly known as frozen shoulder. Today, we break down exactly what is happening inside that joint using two distinct medical lenses: Western anatomy and traditional Chinese medicine. By the end of this video, you will understand your own internal joint mechanics, and we will walk through a guided 3-step daily mobility routine designed to restore your range of motion. Overcoming this level of severe stiffness requires addressing both the structural repair of the tissue and the energetic flow of the joint. The shoulder is a ball and socket joint. Under normal, healthy conditions, it has a massive range of movement, supported and protected by a flexible outer lining called the joint capsule. Looking at this cross-section of the shoulder joint, we can see the Western medical perspective. Initial inflammation triggers the healthy capsule to shrink, thicken, and turn a severe red. The joint space is drastically reduced in a process called fibrosis. Now, overlaying the traditional Chinese medicine framework onto that same inflamed capsule, we examine the energy pathways. TCM views this restriction as a painful obstruction syndrome. External factors like dampness or cold cause qi and blood to stagnate, forming distinct blockages along the lung, intestine, and sanjiao meridians that cross the shoulder. This condition develops in 3 distinct phases. This timeline shows the initial freezing stage. Over several months, pain gradually builds, often worsening at night, while the line for overall mobility steadily drops. Moving along the timeline, the joint enters the frozen stage. The sharp pain may actually decrease, but the shoulder becomes severely stiff, essentially flatlining your mobility. Finally, we reach the thawing stage, where the tissue begins to release and normal function slowly recovers. Whether we define this restriction as structural fibrosis or energetic stagnation, pinpointing exactly where you are on this timeline tells us how aggressively we need to approach your daily treatment. Because we have 2 different ways of understanding the condition, we use specialized complementary tools to treat it at every stage of recovery. Western clinical treatments focus heavily on reducing the initial swelling and pain. This often involves NSAIDs, targeted corticosteroid injections into the capsule, or in stubborn cases, arthroscopic surgery to physically cut away the scarred tissue. On the right side of this split screen, we see the TCM physical interventions, which focus entirely on clearing stagnation. Acupuncture needles are used to restore flow along those blocked meridians. Moxibustion applies targeted heat to expel cold from the joint, and cupping lifts the restricted tissue to pull stagnant blood to the surface. Despite their different methods, both medical philosophies arrive at the exact same rule for long-term recovery. Movement is medicine. Lying on a treatment table is only the starting point. Active, deliberate movement is required to physically pull apart the fibrotic adhesions in the capsule and to continuously push energy through the joint, so stagnation cannot return. To do this, you need a small towel, an empty stretch of wall, and one absolute safety rule: stretch only until you feel tight tension. Never push into sharp, biting pain. Step 1 is the pendulum. Lean forward, let your affected arm dangle completely loose, and use body momentum to swing the arm in small circles. This movement uses gravity to gently traction the arm, pulling the compressed joint space apart, while initiating fresh blood flow into the stagnant tissue. Step 2 is the towel stretch. Hold a towel behind your back, grasping the bottom with your affected arm. Use your healthy, overhead arm to slowly pull the towel upward, drawing the stiff shoulder into internal rotation. In this diagram, you can see how this upward pull physically stretches the thickened tissue of the posterior capsule. At the exact same time, this specific internal rotation activates and unblocks the small intestine meridian running up the back of the arm. Step 3 is the wall walk. Stand facing a wall, place your fingers on the surface, and slowly walk your hand upward like a spider, pushing the limits of how high you can reach. Look at the tension shown across the front of the joint. The wall walk directly combats the use it or lose it nature of fibrosis by stretching the anterior capsule while forcing active energy up through the blocked lung and sanjiao channels. Executing this specific sequence every single day provides the mechanical force required to halt the shrinking of the capsule, while actively clearing the energetic pathways your body needs to heal. The work doesn't stop when the stretching ends. You have to protect the joint during the other 23 hours of the day to prevent the shoulder from regressing. The most critical defensive habit is avoiding prolonged immobilization. If you sustain a minor tweak or injury to your shoulder, you must keep it moving safely, rather than locking it down in a sling. You also need to apply daily heat therapy. Consistent heat physically relaxes the contracted muscles around the joint, and from a TCM perspective, it actively expels the pathogenic cold that causes tissue to contract in the first place. Combining your active stretching routine with these defensive habits, like keeping the shoulder covered with a scarf in damp weather, creates a highly controlled environment. It leaves the joint with no opportunity to freeze further. If you've made it through that routine, you know exactly how much physical effort it takes to force a frozen joint to move. This close-up view shows what you just accomplished internally. By moving the shoulder, you are actively pumping lubricating synovial fluid back through a previously restricted joint space to break up the fibrosis, while simultaneously stimulating your meridians to clear the energetic blockages. This is a self-limiting condition, meaning it will eventually resolve. But returning to full, pain-free mobility takes consistent effort, typically over a timeline of 6 months to 2 years. Repeat this routine daily. Consult an integrated physician to combine these therapies,